my name is Dr. Avesta Panahi and I'm a counselling psychologist at Private Therapy Clinic. My areas of expertise are usually working with young people, children and also the general adult population with difficulties such as identity issues, depression, anxiety, personality disorders and also PTSD or trauma which has occurred from adverse childhood events. Some of the other areas of expertise which I'm really passionate about are working with migration and refugees and minority populations in a culturally sensitive way. My main modalities of working or therapeutic approaches which I really enjoy working with and I think is really beneficial for the general population and people struggling with psychological difficulties is using integrative approaches. So I like to really bring together concepts relating to cognitive behavioural therapy alongside psychodynamic therapy and approaches, combining them together and really ensuring that each client who sits in front of me get a really catered approach to their difficulties. One of the therapeutic approaches which I'm incredibly passionate about is schema therapy. Schema therapy is an integrative approach which again combines concepts from CBT, Gestalt therapy, psychodynamic and other third wave approaches and brings them together to really help people heal their inner child. So a lot of the work that I do is about working with the inner child, working with those childhood experiences and ensuring that a person can really work towards being their best version of themselves. So when someone first comes to see me for their initial session, I really like to focus on getting to know them as an individual. So that means that the first session involves getting a background, historical background, information about their early childhood experiences, what their presenting problems are, how they're making sense of their difficulties at the moment, thinking a little bit about their value system, so ranging from their spiritual beliefs to their religious beliefs, and really combining all of that to create a map for the client to help us understand what's happening in their life at the moment. Essentially, the first session is about getting to know the individual in front of me and ensuring that that therapeutic relationship starts off and has a really good foundation. So I really believe in building a good therapeutic relationship, checking in with the client to make sure that they feel that that work that we will do together is a good match. And essentially by the end of that first session, having a better idea as to what the therapeutic goals are and how we can work together moving forward. In terms of the assessment phase, I like to use about 6 sessions of an extended assessment to really help the client have a better formulation or a map of their psychological difficulties. By the end of that psychological assessment or 6 sessions, we hope to be able to then move forward with a change-focused approach and begin making changes with the client. Therapy can be a scary journey to begin, but it can also be an enlightening process as well, where one gets to build a better sense of self and really gets to explore the different parts to their identity. It's important to know that therapy can be a non-judgmental space and should be a safe space for you to explore all of your difficulties without feeling afraid or that anxious that you'll be judged. Therapy essentially is a collaboration with the therapist to make sure that you can really work on your life goals and be able to reach them. Sometimes people ask whether having psychological difficulties is quite unusual. However, the way I like to see it is that we all have mental health needs. So essentially from the time that we first come into this world, we are born with these needs, such as the need for a secure attachment, the need for autonomy, the need for spontaneity and creativity. And although our parents don't essentially have a guidebook to tell them how to reach those needs and meet them with us, what they do have is the ability to meet them with a good enough kind of manner and perspective. Unfortunately, what we really see in the world is that it can be incredibly difficult to meet those needs sufficiently, which ends up then making it really difficult to have a more of a healthier kind of outlook on life and relationships, which can then lead to difficulties with our psychological and mental health. I think that with the more increasing difficulties that we are seeing in society right now, it becomes more common for all of us to really experience psychological difficulties and challenges at various points in our lives. Essentially, all of these become a shared experience at some point, and I think that we can really use those shared experiences and help each other and support each other in reducing the stigmas, reducing the taboos relating to mental health struggles, and really normalising having mental health struggles or psychological difficulties. Attending therapy is a huge step for many people, and I really believe that if the resources allowed, that everyone would benefit from having access to personal therapy at some stage in their life. It does not necessarily mean that you have to wait for some huge event to happen and to rock your world for you to then access therapy, but it can also be with issues relating to self-development, wanting to just get a better awareness of your relationships and who you are as an individual. As part of that experience, I have also been in personal therapy myself. In fact, many psychologists and professionals who work in the mental health field are usually in some type of personal therapy at various stages of their training programs. As part of the counselling doctorate program, you are required to be in personal therapy throughout those 3 or 4 years. By experiencing personal therapy, I was able to really become a better person myself and do some personal development, but also become a better therapist who can be really understanding and compassionate of the challenges in accessing therapy for the first time, and just be having that awareness in the back of my mind to really ensure that the client in front of me feels understood, feels comfortable, and is able to speak up about any anxiety they have when they first come and see me. Outside of having a busy working life, I'm really passionate about being able to follow through on my hobbies and interests and making sure that I use a lot of creativity in my own personal time. So some of my hobbies will include travelling. I'm really passionate about going to countries where I can learn something new, see a new culture, see new art, and just really get a sense of other people's stories and the way that they live their life. Alongside that, I'm also really passionate about reading books. I'm open to reading all types of genres, and I actively spend my time making sure that I take in a little bit of culture and storytelling from the books that I read. If you find yourself experiencing any psychological difficulties or just having a challenging time in your life at the moment, please don't hesitate to reach out and access professional help when possible. And you can do this by contacting us at Private Therapy Clinic.